My name is Ben Howard and I'm a researcher at Imperial College in London. I'm from the United Kingdom.
My name is Cynthia Awuni. I come from Ghana. I'm a PhD candidate with the University of Ghana and also a scholar on the Pathways to Equitable Healthy Cities project.
So we're currently working in a city in northern Ghana called Tamale. And we're using a co-production methodology to try and enable equitable flood adaptation. So what that means is we're using a research process that brings societal partners like local governments and communities to the centre of the research process. We're trying to understand flood risk in Tamale. What are the drivers and components of flood risk, including the sort of magnitude of hazards, how different people are exposed to flooding, and the vulnerabilities that make people be impacted by flooding.
The case study we presented tried to look at what are the challenges that people in Tamale are bedeviled with flooding. And so what are the issues related to accessibility, their location, is it urbanization, is it about densely populated areas, is it about the location that they stay, or is it that they don't have income to be able to support themselves when there's issues of flooding. So then what are the inequitable elements within Tamale that drives flooding?
We're especially interested in adaptation to flooding, and that means finding ways to cope with increasing flood risks. So we're interested in how different levels of adaptation interact to determine an overall flood risk for an individual and for a household. So city-level adaptation is things like storm drain networks, and we're trying to understand how the current storm drain network changes flood risk within the city, and how it has been designed or not designed affects the way that outcomes are distributed. We're also looking at community-level adaptation, and this includes things like behavioural changes, sort of evacuation plans and early warning, and also structural changes like embankments and community-level drainage. And then finally, household level adaptation is things like building houses of higher quality that can withstand the flood, and building houses on platforms or in compounds.
And so we are trying to look at the case study and see how we could bring about access to equitable adaptation strategies for people living with Tamale to be able to avert flooding. So basically our case study talks about the process of how we bring stakeholders together related to academia, related to local city authorities, local authorities, communities, to discuss issues around flood and health, and how the urbanization within that system has created problems related to flooding, and how it affects their health status, their incomes, and many more.
So we're starting to reveal that different groups of people have different levels of access to these adaptation opportunities. So people that are wealthier, of a higher socioeconomic status, they tend to have higher access to these levels of adaptation. And sometimes that also means that some of the exposure, some of the risk is offset from wealthy communities into poor communities. So on a city level, this actually reduces climate resilience. So we're trying to find ways that we can enable a more equitable adaptation approach on a city level. And that means designing a city level strategy, including these societal partners.